Thank you. So we're going to be looking at arriving and settling in the UK, and I should apologize now on behalf of my co-chair, Dr. Azza El Gunaimi, who was supposed to be leading and facilitating the session with me today, but unfortunately not able to join us because she's unwell, but I know she's cheering us from where she is at home. So we're going to be talking around different things. Now, we're not by say any specific experts on your personal family situation or financial situation, but we just want to share some tips and things that maybe will be useful and hopefully remind you as you get into practicing. So we're looking at personal family life, social, financial, professional work. So yeah, here we are. You are either in one of these places, in these brightly colored spots on the map in front of you, or you're going to be there very soon. I've seen on the chat people sharing where they're going to be working, where they are. So you're going to be one of these nice colored areas. Some of you will already be familiar with life in the UK, but many people will not. So like I said, hopefully cover a few things that you might find useful. I couldn't have said it better. I think both Victoria and Dipfi in their conversation really made it clear about the need to believe in yourself, to have that mindset that you will succeed. We're not going to sugarcoat it for you. We're not going to say, oh, it's all going to be roses and sugar. There are challenges. And all of us, I also remember my own experience when I had to switch from psychiatry that I'd been there for a couple of years to general practice. And I think my very first post was in the special care baby unit in pediatrics. I hadn't touched a baby or a child for several years. I'd been focusing on the mind and mental health. So there was that sort of baptism of fire that a lot of us would go through. But exactly as Deepthi said, believing in yourself, speaking up, don't be afraid. Don't think that they're going to look at you funny. Please, if you don't know something, speak up, but believe in yourself that you're going to succeed. But I think it's really important, after saying that our training is rigorous, I think it's really important that we bear in mind how to look after our health, how to protect ourselves. So it's important that you're registered with your own GP, and this applies to both yourself, and if you've come in with any family, spouse, or children, please be registered with a GP and find a dentist. Don't wait until there's a problem or there's a need to see any of these personal care providers before you start looking for them. It's also important that you get through with your occupational health, especially for those of you who will be starting off with a hospital-based job. Make sure that you've completed all your pre-employment checks, including, and it may include things like providing a blood test and proof of vaccination to the occupational health department. Some hospital trusts won't allow you to start work if that process hasn't been completed. There is lots of well-being support for doctors, for GPs, for IMGs, considering the fact that it is a lot. It is a lot that you decided to leave your own home country where you've received your primary qualification, for example, and you're so used to the way they practice, and then come over to a different place to learn. Yes, medicine is medicine all across the world, but there are differences, and it is a big deal, a big challenge. And sometimes it can be a lot for people to manage with. So don't be afraid to reach out for help if it's needed. We're really interested in supporting your well-being. And that can include different ways, by reaching out to peers, friends, networks, or communities. I'm going to share a few in shortly. But there are also social media platforms, for example, Facebook groups. I found a group like Nigerian Doctors in the UK quite informative and helpful, very supportive for asking different questions, both related to work or personal issues like accommodation. But just being part of those networks would be very supportive. There is a social prescriber scheme, which is fairly new and not available in every single part of the country. But what it is provides individual support, either face-to-face or online, or via telephone, for GP trainees and their family members to explore ways of improving health and well-being. So, and it does depend on the area. At the moment, I know of one in Yorkshire and the Humber, so that's available for people in that region. But if you're not, then obviously you can go through your GP, you can go through your occupational health if you need to find help in terms of your well-being and support. So I'm going to play a little clip now from this video. I hope it will. Let me just play that, and hopefully you guys will be able to hear. Bear with me a second. Just give me a moment just to get this sorted out. Okay, so I'm just going to turn off the security settings. I beg your pardon. Just give me a second to get that on. Okay. Can you still see the screen? Is any of the...
we can, but it's not in presenter mode at the moment.
Okay, all right. Let me come back to presenter mode again.
I don't know about anyone else, but I'm not hearing sound.
No, can you reshare with sound, Sylvia?
I beg your pardon?
Can you resound? Can you start again and reshare with sound? We can't hear it.
I
on
beg
our
your
side.
pardon. Okay. Sorry, let me see. So reshare with sound. I'm not sure why it's done that. Is that any different?
No,
not
is it
yet.
playing?
Okay, let's see. Are you able to hear now?
No, still nothing.
I am so sorry.
I have a feeling it's very low. I can hear something very low in the background. Sorry about this, everyone. We'll sort this out in just a second.
Okay, so let me try this again. So I'm just going to have to end the show here, and I'm just going to have to increase the volume and see if that works better. Then I'm going to start presenting again. Okay, let's try it. Hopefully third time lucky.
Quite a few differences in the communications.
Is that better?
Can you put it even louder? Because I can hear it, but it's very low.
It is maximum on my end now.
Oh wow. Okay. Maybe it's my computer.
If it's not audible at all, then we can skip this and move ahead. What do you guys think? Should we skip it?
Yeah, I mean I can't hear it, and my sound's on maximum.
Let's skip it, not a problem. I'm so very sorry. I thought we had tested this and we were so sure this was going to play. But like we said at the beginning, we are going to be sharing these slides with you, so you'll be able to play this video in full. The key aspects that this video was going to demonstrate to us from a set of different individuals was the issue about cultural differences, and so that you don't feel that you're on your own. We all have experience. When I say we, I mean individuals who received their primary qualifications outside the UK have experienced this in the past, where we've come in, and you have to understand, you have to overcome these differences. And what's interesting is not just experiencing a different just UK culture. You have other different ethnicities and different people from other different countries coming in. So you're exposed to a mix of different cultures that you need to learn how to work with and adapt. So just recognizing and acknowledging that this is the case is what the video talks about. So please watch it. I think it's really useful to get that grounding. So the other thing we wanted to talk about was just bear in mind that everyone's at different stages. Some of us will come here with family, or you might come here by yourself and you have family back home. I think it was Deepthi who said that reinforce the importance of your family. That connection is still so important. We encourage that, we support that. If you're here with your family, with your spouse and children, or here as a single parent, we also support that. There are flexible training options, so less than full-time training, that you should be aware of. You should speak to your trainer or your training program directors about if it's relevant to you. You have options, you have access to maternity leave and different support benefits that you have that you should take advantage of if they apply to you. I'm going to be talking a little bit later about childcare and school and accommodation, but just really important that these are the things that you will experience as you get into it. Okay, so the next slide, which hopefully everyone can see, looks at the different groups that you will be involved with as a GP trainee. Now, you will rotate from primary care to hospital. So what that means is that you will rotate from the general practice to a hospital post. Or as Dipsy shared her experience, she started with a hospital position, and then after some months, she gets into general practice. That's how the rotation goes. But there are different organizations and different groups that you will you'll encounter along the journey. So starting off, we're just going to go around this circle quickly. You have your LET or Lead Employer Trust.
Sylvia, so I'm just going to come in. We're still stuck on the personal, family and social one. I think if you unshare your presentation, just reshare. I think it's probably got stuck.
Okay. Apologies, everyone. So let us start again and bring up the presentation. And please let me know when you guys are able to see.
Yeah, perfect. We're on the IMG with the arrows.
Okay, fantastic. Okay, so let me just make sure I've got presenter view on. Okay, so you have the Lead Employer Trust, and that's responsible for that's really your employer. That refers to your employer, and we're talking about different groups that you'll be involved with. So they'll be responsible for your contracts. They'll manage your human resources department. So any issues around contracts and rotas, you'd have communication with them. Another body that you'll get to know are the statutory education bodies that are in the different parts of the country. So you have statutory education bodies in England, in Northern Ireland, in Scotland, and in Wales. So for England, they're referred to as NHS England, which is the NHSE that you can see on the screen, that was formerly known as Health Education England. And you have the relevant bodies in the other devolved nations. So NIMDTA refers to the educational body for Northern Ireland, NES is for Scotland, and HEIW is for Wales. So these are the groups that organize your training. They follow the curriculum that has been set in place by the RCGP, and they deliver your training. They arrange for different sessions that tie into the curriculum, and they will organize and appoint a training program director who will be responsible for your training. We thought it was really important to keep individuals or keep groups like family and friends, because it's not a waste to remind you that they are so important, both in mental well-being, both in providing support in your busy training journey. Now, at the bottom, you will see ES/CS/TPD. So let me quickly go through what those mean. And I think some of you might already be familiar with those terms. But if you're not, so the ES is the educational supervisor, and that refers to the individual who you will work most closely with. They are also known as your trainer, your GP trainer, or your GP educational supervisor. So if you're in general practice, you will have a named doctor who is your trainer, who is your line manager, if you like, the person that you report to directly, working with you really on the front line. So they'll be available for you to debrief with. They'll be responsible for carrying out assessments with you while you're in general practice. They'll be responsible and contributing towards your final assessments, your midway assessments, and you're going to learn more about this in the session we have in the afternoon. So that's the educational supervisor. You have a similar individual or a similar role while you're in hospital, and we refer to them as the clinical supervisor. And they're doing pretty much the same thing. They are your direct line manager or direct supervisor. You're working closely with them, reporting to them. They're conducting assessments on your performance while you're in hospital. And then to complete that triangle of people directly involved in your training is the TPD, or the training program director, who I mentioned earlier, is coming from the educational body that organizes your training. So they could be coming from the postgraduate school, they could be coming from your deanery. They are working with your educational supervisor and clinical supervisor to ensure that your performance is being assessed, ensure that you're working according to the curriculum, working with you to prepare you for your exams, whether it's the MCQs or your different workplace assessments, and getting you ready for your final certification. Of course, your colleagues and peers are important. It's really important that you quickly get into a network. You might come in here as, you know, on your own, but it's good to make contact with people in the same area. I can see in the chat already that people are making connections, which is fantastic. Please, please look out for people working in the same area as you, get to know them, get to support yourselves and so on. And I'm going to finish last with the RCGP that you already know, but I think it's important. You'll be working with all these bodies. You would see these mnemonics, or sorry, you will see these abbreviations from time to time, and it may take a while to get to know what each of them means, but you will get to learn them over time. The college is your professional body. The college is about 70 plus years old. My colleagues in the chat, correct me if I'm wrong, but it's over 70 years old, and it's the professional body for all general practitioners in the United Kingdom. Its main aim is to ensure that we adhere to standards. It sets the standards for clinical practice, but it also provides support for GPs right from training and all the way throughout our careers. So it makes sure that we're trained in the right way. It provides support and training a training course or educational course for after you've completed your training. So for example, myself, I attend college events, which are learning events. I attend college events that are well-being events. I attend events that are networking events. The college celebrates my achievements. It invites me to award ceremonies to celebrate the work I'm doing. It awarded me the role of fellow, which is the highest position a member of the college can aspire to. So the RCGP really is your home. And this is, you guys are at the start of the journey, and it's going to be part of what you do for several years to come. Okay, so there's some associations and communities that it's worthwhile being aware of. And some of you already know about them, but just in case you don't, and by no means is this list exhaustive at all, because I think you can also find many in other different religions or different states of origin, but just so that you are aware that you can also find them as suitable tools or platforms for networking, for getting to learn or know people who share the same culture with you and who are also doctors or also GPs. So, you know, please take advantage of membership if you can and if you're interested in. And these are examples that Nigerian GPs UK, the Medical Association of Nigerians across Great Britain, the British Islamic Medical Association, British Association of Physicians of Indian origin, Association of Pakistani Physicians of Northern Europe, Arab GP and GP trainees in the United Kingdom, Sudanese Primary Care Association, local communities. Like I said, the list is by no means exhaustive. It's really important that you're just aware that these exist and are of value for different roles that you have. So now let's talk a little bit about finance. And again, just to reference, we're not here as financial experts or investment advisors, no. But we just want to touch on a few things that we think are useful to be aware of and to remember as you get into the UK, whether you've arrived already or on your way into the country. And one of them I think is really important, and most people are already familiar with this, is make sure you have sufficient funds to hand. Yes, you're coming in to start work, you're coming in to earn a salary, it's true, but we recommend that you have a good amount of money. And yes, you've spent so much already, I totally understand that, but to live comfortably, to manage for any issues that might come up unexpectedly, probably having enough funds to keep you for 2 or 3 months will be very useful. We also like to remind you about recurring bills and payments that you might incur. So if we start first of all with, when you get into the UK, let me just address those who perhaps are still abroad. Think about expenses getting you from the airport, airport transfers to where you're coming into. Think about expenses, for getting either a new mobile phone or a SIM card. Think about those kind of expenses and be prepared for them. When it comes to rent, please think about the different costs that will be involved. You might be required to pay a deposit. Please be careful to look at the rent agreement that you come into, so that you're prepared for any unintended costs, any penalties, for example, for late payments or for damages. Please have a look at the rent, the agreements. The mortgage is something that some people might be able to do now, or it might be something that you're going to look at later on in your training, maybe after a couple of years when you're able to get a credit history, and when you can actually access that resource. But again, these are other things that you should put into consideration are, thinking about where you stay and how close it is to where you work. or how close it is to where your children are going to be going to school, and other different areas or issues that are important to you. Those are some of the things to think about or to consider when it comes to rent and mortgage. And the other thing, of course, is transportation. So very important. Some people might be able to drive. Some people might have already been living in the UK and have a UK driving license. Some people may not be. It's good to get to know the different transportation networks. They're very simple to use, but you just need the information. Many of them have websites online that you can sit down and read how they operate. So, for example, you can get onto different bus schedules from their websites, depending on where you stay. You can get on the bus and pay for a trip, or you can get a pass that will cover you for a day's travel or a week's travel and so on. And you can have similar things for train journeys. I think what's important is before you get into your place of work, I think it's really important to plan ahead. Make sure that you know what service, whether it's a bus or a train, gets to the place that you're supposed to turn up at work, how long it takes to get there. Plan all this before the day so that you avoid running late and you're able to plan your journey properly. And there are different costs. For example, council tax, that's a mandatory payment if whether you have a mortgage or rent. Now, for some people, it might be included with the rental payments. Others, it will not. Be careful. Just have a look and be clear what it is that you're paying for. The same thing applies to utility bills. For some landlords, it's included within the rental agreement. Many it isn't. So again, have a close look at that. There's childcare, things to think about childcare for those who are coming in with children. Useful to be aware that there is a government body that regulates different childcare organizations. So whether it's a childminder or a school, this is called the Ofsted. So you might come across something called the Ofsted rating, that if you're thinking about what school to send your children to, clearly you're going to have a look at the school website. If you're trying to make a decision about where to send them and so on, the Ofsted rating, one that is reputable, is one such to look out for. There are some children that can have access to free childcare. The nursery or the organization will let you know. I think 3 to 4 year olds have certain number of hours per year that's tax free. So please find out from them, ask about that. Then, of course, for those who are mortgage or have a car, you have costs like home and car insurance that you need to pay. These are recurring bills that you should be aware of that can sort of put a little bit of pressure on your pocket. And just being aware of them, asking around and getting to know, at least you're prepared and you're not surprised when these costs begin to come up. Of course, there are your professional fees as well. For example, they've just put a couple here from our regulator, the General Medical Council, subscription fees to the Royal College, and subscription fees to the British Medical Association. And these are fees that usually can be discounted for doctors in training or doctors depending on their year of training. There are fees that can be paid by direct debit, either on a monthly or quarterly or annual basis. Always important to sort of have a look, have a conversation. You can call up the different organizations and find out specifically what kind of rates that you pay. But bear in mind that they would usually offer discounts, especially for training grades like yourselves that are just starting. Just a quick word about savings, and this just refers to if somebody's switching from a locum or non-training position. So, well, I was going to say similar to what Dipti said, but if you've been working as a locum in the UK for maybe the last 2, 4, 5 years or something, and you're switching to general practice, there may be a drop in the pay as you go from a locum position to a trainee. So just be aware of that. I don't have any specific numbers, I'm sorry. But again, it's something that we would like you to be aware of and factor it into your planning. So we've talked a little bit about some of these organizations listed here. And I've mentioned already the role of the college. It is your professional home. It is the organization that provides your training curriculum. It's the organization that provides support to you throughout training, and that support includes both clinical well-being support. It provides mentorship. So mentorship is very important. I know that's at the bottom, but I want to say it here, that we have the RCGP forum, mentoring forum or mentoring scheme that you can join. And I will put the links for all of these things in the chat once I've sort of finished, so that you can access them, or you can go to the RCGP website and it's got lots of helpful information. The General Medical Council, of course, you're already familiar with because that provides you the license to work, but it's our regulator and responsible for making sure that we adhere to professional standards, looking at ethics. And we have somebody coming to talk to us more about the work of the GMC, especially as it applies to us later on in the afternoon. The British Medical Association is another organization that you'll be involved with, or you should know about. And it's the membership body for all doctors, and medical students. So this applies to doctors in training, medical students, and doctors, fully qualified in their specialties. And it's like the trade union for doctors is the way I sort of look at them, because they're involved in things to do with the workforce, things to do with negotiating about doctors' pay and contracts and pensions. This is all within the BMA's remit. So just to be aware that sometimes the role of these organizations in terms of providing representation can overlap a little bit, but when you look at them quite clearly, they do have individual roles. Also, there are medical defense organizations, for example, the MDU, the Medical Defense Union, the Medical and Dental Defense Union of Scotland, and the Medical Protection Society. These are three of the medical indemnity organizations. It is mandatory for you to be part of an indemnity organization to be a member. So we do have somebody speaking on this just after me. I think that would be maybe in about 10 or 15 minutes or so, to be talking to us around this issue of the indemnity organization. So you have the opportunity to hear from how they work, learn about their organization. I've talked a little bit about statutory education bodies, and we just repeat that a little bit. So I appreciate that these letters may not make too much sense at the moment, and that's fine. It's, you have to start somewhere. But I talked about NHS England, which represents the training, which provides training for doctors in England, and the similar education bodies in the other devolved nations. So NES for Scotland, Wales and Northern Ireland. They also will be looking at providing enhanced induction, because we think it's so important that for individuals coming in here who haven't worked in the UK before, or who perhaps haven't worked in general practice in the UK for some time, really important to learn the different systems and the different ways that things work. So if you've not heard it already, plan and prepare, really important. Whether you're starting in hospital or whether you're starting in general practice, it's good to plan ahead. You could do that by sending an email or, getting on the phone to whoever is in HR of your hospital trust, or if it's a practice, it might be the admin or the reception at the practice. Say, hi, introduce yourself. Can I pop over for a visit before I start work, if that's possible? That gives you the opportunity to find out how exactly am I going to get there? How long does the bus take to get there? Or is it a train? Or what exactly do I need to get there? So that you're not in a fluster when you get in your first day. You want to make a good impression. Who doesn't first day of work? But at least you plan ahead of time. And then that's an opportunity to ask them different things. Some of you might have issues around your rota or contracts or things that you want to ask today. We may not be able to answer all that because it can vary from one place to the other, but getting in touch with your HR department, either the hospital or with your general practice, to find out or to iron out different things, arrange for a visit if possible, speak to your educational supervisor. Is it possible? Have they got, 15, 20 minutes to meet up with you? They'll be happy, or even just speak to them on the phone. The fact that you've taken that opportunity to try and get to be part of the team, that's always welcome. Really important to be early to be early for work, show up when you're supposed to show up. If life happens and sometimes you're not able to turn up, that happens. The next best thing is please call somebody and let them know, I'm really sorry, so and so has happened, I'm running late, I'm stuck here. That's better than keeping silent and then just turning up after 3 hours, because people don't know what to say. They just feel that you've just not turned up. But if you're running late and as soon as you realize that you cannot make it for that time, you make a phone call and say, look, I'm really sorry, this has happened to me. People are understanding. They can make accommodation, make alternative plans. Please do that as the next best thing. Like I said, you want to talk about your rota, that will be best discussed, obviously, with whoever is your local employer. Your lead employer, trust the HR department, or have a conversation with the practice team as well. Be aware that you have access, or you're entitled to annual leave, study leave, maternity leave, as the case may be. Have a look at your contracts, your agreement letters, and if you're requesting any of these leaves, please make sure you do it early enough. Give enough time for anything to come up and for them to make arrangements so that you're not disappointed, and for the time, and you're able to get the time that you want. Really important, I've mentioned it before, but let me just repeat it, get a mentor. Like I said, I'll leave a link for quite a lot of the different contacts that we're talking about today. The college has a formal mentoring scheme. And so if you're interested in finding a mentor, you can apply through that. But mentors can also be family, friends, or people that you knew beforehand who, they've been working in the country for some time. They can sort of guide you through certain things here and there. Really important if you can access that. They will also share opportunities. I'm so glad that Victoria and Dipsy talked about their experience at length. It's not just about clinical practice. There's so much more development to do. Training is a few years and then it's done. And then there's so much to do, whether it's with the faculty, different types of roles, special interests, so many things that you can be involved in after you complete your training. So on this screen is a list of the useful links. I'm just going to stop now because I think we've come to the end of this bit of the presentation. Again, I'm very, very sorry for the mess up. Let me stop sharing. Yep, I'm very sorry for the error with the video this morning. We did test it before we started, so I'm not sure exactly what went wrong. But I think this is a good time for me to stop. I think we have about 5 minutes for questions. I don't know if anybody has put in any questions in the chat with regards to that. So let me know what you guys, if there are any questions at all around coming into the United Kingdom, any issues that you wanted to raise, please let us know. Okay, so Mazin says, thank you. Well, you're very much welcome. And then I can see from Mohammed, I'm just starting from the bottom. I'll try and go through to the top, but does the trust offer any financial assistance for relocation? So Mohammed, thank you so much. That's a great question. I think it's something that you can specifically request from the trust and from the HR. Some trusts do. Not all trusts provide this. So I can't tell you yes or no. But it's a very good question because it may be that your trust does and they can provide some support. So please get in touch with them and find out what provisions they have. So I'm just going to look on the question and answer sections. I can see somebody says, registration with RCGP, do I go for the option AIT? When I click on the link to register as GP trainee, it does not work. Can I register now before I have an NTN number? So this is something that will probably need some help to answer from the guys in the back, on the back end, because I'm not familiar with how what happens when they click on that option. So perhaps somebody can help to answer this for me.
Hi, Sylvia. Yeah, we've noticed it. Thanks for that question. We are forwarding the question to our membership services team, who are best placed to answer that. So if you bear with us, we will answer that in due course. Thank you.
Right, brilliant. Thank you so much for that.
And just to add, if everyone can, I see there's a lot of questions in the chat. If where you can, please use the Q&A function on the bottom banner of your screens, please. It's one of the options you click on, and you can ask questions in there if you can. Okay.
Thank you so much for that. So the second question here in the Q&A from Tino Tenda. Hello, Tino Tenda says, I understand I have to secure a second indemnity cover on top of MPS. Any recommendations on an appropriate second indemnity cover? So it depends on the type of indemnity you're looking at. I don't know the exact details, and you should first of all discuss with MPS. So I don't know who said you have to have a second one and in what context. Because they can provide cover for your routine work in the practice, for example. And then there are some other things, for example, working as a private GP, working online. I don't know your specific situation. I would first of all have a conversation with MPS because we have 3 indemnity providers that sort of work with the NHS. There are other private organizations, and you have to do that research to find out, do they provide what you're looking for? But I would first of all have a conversation with the MPS. If they don't provide the extra that you're looking for, then you can contact the other ones, the MDU or the MDDUS, to be able to clarify that. So let's see. The next question says, how do I arrange for a shadow period in my workplace before I start work? Bring them up. Call up the, so ring, if it's a GP surgery, bring the reception, or just ring the surgery line, introduce yourself, ask to speak to the practice manager, or if you know your educational supervisor, ask to speak to your educational supervisor. At the end of the day, it will end on the table of your educational supervisor, and say to them, are they able to provide you with a shadow period? And some of them actually, by the time you get in, perhaps the first week or two, will allow you to shadow different staff around the practice. So that's something that you should get as you come into your training and the practice. But speak to your educational supervisor. In hospital, the same. You go through HR and see if you can, or the secretary of your clinical supervisor, if you know who they are, and have that conversation that you'd like to see if it's possible to have a shadow period. So somebody, Chukwemeka says, how soon do you advise I connect with my ES, before or after commencement of the role? If you can, reach out to them before. So before you start, it's just a courtesy. I just want to introduce yourself. It might be an email, it might be a phone call, probably a phone call, because you might not have their email already, that you'd introduce yourself to them and say you're looking forward to meeting them. Ask if it's possible to just come and visit the practice, and what time will be best for that purpose. And that's one way you can establish connection. Now, they're very busy. I have to let you know, they're very busy. Victoria, for example, who spoke to us first, was in the middle of clinic. So she had put aside her patient for like 20 minutes to talk to us. So they're quite busy, but I think it's a great thing you want to offer, and then they'll be able to provide some advice if they can do that. And then Chinwekele says, thank you for the presentation. Is it possible to confirm how many hours a 3-year-old is entitled to for nursery? I can't confirm that specifically. I don't want to give you the wrong answer. I can look for the link and provide to you, and it's usually, there's a gov.co.uk site that you can find that information. I'll look for that and put it in the chat so that you can have access to that. It's also good when you've picked the nursery that you're going to say to them that you're aware of this, and then they can also provide the information, and then you can double check with the information you get through gov.uk. Is the RCGP membership sponsored by the lead employer, or do we pay for it ourselves? I thought one of the team was about to come in there. I'm going to leave them to answer that. I can hear somebody wanting to come in. Do you guys want to do that for this question on RCGP membership?
Sorry, Sylvia, repeat that one for me.
So this question is the RCGP membership sponsored by the lead employer, or do we pay for it ourselves?
That is a great question. And one will have to defer and find out, if that's okay. Leave that one with us as well.
Yeah, I mean, I could just chip in. I think it's something that, because I think it's discounted rates that members have to pay, but it's been a few years since I did my training. I think it might be that there's some arrangement where during training, some of the costs are deferred. So like Louise said, she'll get back to you guys on that. We're storing the questions. Any ones that we're not very sure around, then we will get back to you. Because we don't want to give out the wrong information. So we're going to hold on to that question. So Chidima here says, hi, my EDD is due in about 5 months. Marvelous. What are my options as related to maternity leave, and how will it affect my visa? Wow, I don't know the answer to this question. Usually very supportive, when nobody's going to penalize you because you're pregnant or you're about, however many months away from delivering. That's not the problem. But really important for you to get the information. So it would have to be from, if it's your practice that you're starting with, speak to them about maternity leave, or if it's the hospital that you're in, speak to them about HR. I think, Stefan, did you want to come in to answer this question here? I thought I saw Stefan. Yeah.
No, sorry, no, I wasn't going to come in there. I'm just trying to answer the questions through typing in the chat.
Okay, all right, that's fine. And then, so I'm just going to do 1 minute because I think our next speaker is already here. And again, if I don't answer your questions directly here, they will still be answered. So please put in any questions that you need. If we don't know them, we will definitely find out. How do I get the bus ticket to use weekly or monthly? You can either buy the bus ticket on the bus, or if you go to the website. So I don't know where you are, Ruth, and wherever it is that you're located, look on the web, look online, Google, whatever bus service, or, there are different ones. In South Yorkshire, we've got different, I can't remember the name of my bus service, but it depends on where you are. So if you just Google, and they will tell you their fees, they will tell you their routes and all that information, you can find.